Hey y'all, hey, so Dr. Amaka here, plastic surgeon, Nashville, Tennessee. So let's talk about aesthetic flat closure after mastectomy. So fortunately today is my breast reconstruction day. So I work with a breast surgeon who actually does mastectomies for women with breast cancer, but also women who have a genetic susceptibility to breast cancer. And so what I do is I come in after the mastectomy and I start the reconstructive process. So that's kind of falling on today, which, you know, what a coincidence. So how it works is basically, a mastectomy is basically removal of breast tissue, right? And so what an aesthetic flat closure basically means is that you don't put an implant in, or you don't do an autologous reconstruction. An autologous reconstruction is basically describing reconstruction using your own tissue, either from the back, which is called latissimus flap, or the abdomen, also known as a tram flap or a deep flap. So some women opt not to have reconstruction, and that's a total option. When I describe the options, the options are you can use your own tissue, you can do implant-based. The majority of reconstruction I do are implant-based, or you can go flat. And I really appreciate this question because we don't talk a lot about flat closures, but the idea for me with the flat closure is basically to remove the skin and kind of shape the skin in such a way that the chest wall is flat and smooth, and the scar is smooth as well and kind of curves, and so it doesn't really look too traumatic. The most common way I do this is I'll do a single incision basically along the chest, going like this. So a single incision going like this, and I really extend that incision out laterally, or basically to the side, because what can also happen after mastectomy is a phenomena where suddenly you feel like you have this heavy tissue on the side that you didn't have it before. It's not that you didn't have it before, you had it before. The difference is that now, before you had the weight of your breast pulling that tissue forward, right? The weight of your breast is pulling that tissue forward, and suddenly afterwards you don't have that breast tissue pulling your tissue forward, and you don't have gravity, right? And so now that tissue just kind of sticks out, it's kind of numb, so you can feel it more. And so with an aesthetic flat closure, the other thing I really pay attention to do is to remove that tissue so you don't have dog ears on the side, and sometimes that means that an incision may extend, kind of in the inframemory fold, the prior one, and extend all the way to the side just to be able to address all that skin. But that's kind of how it works. And aesthetic flat closure is a thing I do. And then also breast surgeons do it as well. I work with so many amazing breast surgeons who do beautiful work with aesthetic flat closures. I think the biggest thing is being your own advocate, right? Whenever I see a patient, I never tell them, like, this is what you should have. If they tell me they want a flat closure, I'm like, talk to me about that and let's talk about it. But my big thing is, like, finding out what your goals are and what you would like. But that's how it works. And y'all, this month is Breast Cancer Awareness Month, so make sure you're doing your self-exams, make sure you're getting your mammograms. And remember, there's no age that's too young for breast cancer. I've seen 20 and 21-year-olds with breast cancer. So if you feel something abnormal, be your own advocate. If something doesn't feel right, you probably know it, right? So be your own advocate, and you know your body.